Welcome everyone. Good afternoon to all. It is my absolute pleasure to introduce an exceptional leader in the field of hospital administration, Mr. Abhijeet Singh Sidhu, with over 13 years of rich experience managing top corporate hospitals in India. He is powerhouse of expertise in hospital operations, quality management, and strategic healthcare planning. Currently serving as the center head at RG Hospital, Ludhiana, he has been instrumental in driving excellence, ensuring seamless healthcare delivery, and spreading house business growth. His strong leadership, financial acumen, and in-depth knowledge of regulatory standards make him a visionary in the healthcare industry. Today, we have the privilege of learning from his vast experience and insight. So get ready for an engaging and enriching session. Over to you, sir. Thank you.
Uh, Hi everyone. Thank you, Anshika, for this great introduction and kind words. I would like to know what would be the preferred mode of communication. Which language should I present the today's topic?
So English will be better because international students are connected with us.
Okay, right. So my today's topic would be maximizing patient. I just screen share. Maximizing patient. Are you able to view my screen? No, it's not. No? Is it visible now? My
Yes, sir.
screen is
It's
visible?
Yes, sir. Yes, sir.
Okay. So, my topic would be maximizing patient engagement, building strong healthcare connections. So, if I would say before starting the presentation that what do you believe that why patient engagement is necessary? So, could I have some answers on this question? Why patient engagement is necessary these days, or what do you think that what could be a reason to have this kind of presentation or a topic to be discussed in your teaching curriculum? Okay, patient engagement is a widely accepted phenomena these days because today's era is mostly technology driven. So that's the reason why patient is more aware and why the healthcare organizations feels that patient engagement is necessary. So objective would be to explore strategies to maximize patient engagement and build stronger healthcare connections in the healthcare organizations with the patients or your clients. So key pointers we will be covering importance of patient engagement in healthcare, what would be the impact of stronger connections with patients on health outcomes, role of the technology, like I said, that the era is technology driven. What is the role of technology, communication, and trust in such engagement? And the last, how can we build the trust with the patients? So, what is patient engagement actually? Patient engagement is the involvement of patients in their healthcare decisions and the management of their health. So, this implies this is really simple to understand. It is involvement of the patients in the healthcare decisions and the management of their health. So we were discussing what is patient engagement. Patient engagement is the involvement of patients in their healthcare decisions and the management of their health. So these days, when patients are more aware about their healthcare conditions, or many of you, in fact, even me, even my family members, whenever we suffer from any disease condition, what we do, we immediately go to Google and we find out what would the perspectives, how can we get the treatment, what sometimes we diagnose also, we Google diagnose ourselves, right? So patient engagement starts from this point. Patients wants to get engaged with their healthcare decisions and obviously the management of their health. So key components would be communication between patients and the healthcare providers, shared decision making, active participation in treatment plans. We will explain this thing. So why is patient engagement important? Patient engagement is majorly just to discuss and to implement and to ensure that the healthcare outcomes should be better. The ultimate sole responsibility of the healthcare provider or the outcome they want is that the health outcomes of the patient should be proper or as per the expectations of the treating doctor or the healthcare advisor. So patients who are engaged in their healthcare, they are more likely to get the better treatment plans, and they can engage and they can even have more adherence to those plans. And obviously, if there are chronic conditions like patients suffering from carcinomas, cancers, or even kidney failures, for which they have to get multiple admissions or prolonged admissions, where the length of stay in the hospital is quite more. So, in that scenario, also patient engagement helps us to relieve or to get relief from their disease condition early, because they are more engaged in that. Then again, hospitals, how healthcare organization is benefited, they will get more, they will get a higher satisfaction index of their patients. So patients would be happy. Patients would love to see you again. Would love to visit your hospital again. And again, the foremost and the important factor, which for which patient engagements are very important for healthcare organization, they they will end up having more cost efficient treatment. If the patient is engaged, your hospital readmissions, your patient's readmissions would be less, and there would be less requirement of any unnecessary procedures as well. That's why patients should be engaged more. Now, what are the barriers of patient engagement? The first barrier, lack of health literacy. This is again a point that why, because the reason is that sometimes we can see that patients are not that literate, or the clients are not that literate to understand the medical terminology or the diagnosis. That's the reason that we have this factor, we have kept this factor as the foremost factor. Patient may not fully understand the diagnosis or treatment options. Then again, cultural and language differences, patients coming from cross culture, like I can see many of the students coming from the south side. So you even we have patients coming from Africa to get the treatment. There is a kind of language barrier with the doctors or the caregiver or the front office staff. Sometimes they don't understand what kind of problem you have, what kind of diagnose, or even which doctor you want to see. So this could be a reason. And then again, time constraints. Sometimes hospitals are very busy, consultants and doctors are really busy to spend plenty time on the consultations or to resolve the queries of the patients. So these could be reasons of the patient engagement, barriers to the patient engagement. Are we clear till now, or am I going too fast? Should we go to the next slide, or there are any questions till now?
So continue.
Okay. So now we will discuss some strategies for maximizing patient engagement. So the first and the foremost for any kind of engagement, that is communication. So effective communication should be there. We promote this thing in hospitals to use simple, clear vernacular language when explaining diagnosis and treatment options. Right from the starting of the treatment of the patient, when the patient gets admitted, or they plan or we advise admission to the patient, we get a consent form signed, if you are aware. So that consent has plenty number of points mentioning that this treatment would be given to you, or you might undergo some procedure or surgery. Sometimes we have a different consent from surgery also. So that consent should be, the guideline says that that consent should be in vernacular language. And in case you are treating a patient who cannot understand, like in Punjab, first language is Punjabi. So we need to have the consent form. It is the guideline of government that we need to have the consent form in English as well as in Punjabi. So in case we have a patient who is from South India, and he or she doesn't know about English also, they cannot speak English also, or even they cannot understand Hindi also. So at that scenario, the guideline says you should have an interpreter to interpret the consent form in his or her language, and that goes in the consent form also, that this person has interpreted this form or this consent form to them. So effective communication is very important to engage the patient. Then we have active listening to ensure patients' concerns are addressed. Again, likewise, I said the are going into consultants' OPD chambers. So we will make sure, or we have to make sure, that the consultant spend enough time with the active listening, that what kind of problem patient is facing, how can we engage the patient. This is the foremost. Then we have personalized care, tailored care plans to meet individual needs of patient. Again, different patients, they come with similar problems, but that doesn't mean that that same care plan would be replicated to the other patient. It is very important to understand, to maximize patient engagement, the doctor has to find out the that fine line where the treatment could be different. The same medicine regime cannot be prescribed to for similar set of patients. There could be different family histories, there could be different diagnosis, there could be different medical history or maybe surgical history, which might change the care plan. Showing empathy and building rapport with the patient. Now, uh, the third important aspect, technology integration. Using patient portals for easy access to health records, test results, and appointments. We will discuss this thing, how technology is useful these days for patient engagement. Utilizing telemedicine to offer convenient virtual consultations. Telemedicine post COVID 19 exposure, post COVID scenario, telemedicine has taken a boom in the healthcare industry. Patients are more comfortable in getting consultations via telemedicine. Previously, there was a scenario when patients, even patients with high level of literacy, they were not very comfortable having telemedicine or teleconsultations. So this has changed the whole bubble of healthcare, Indian healthcare system. Next is education and empowerment, offering educational materials to help patients. We have a special category of patient information leaflets, we call it PILs, which we offer to the patients before they plan for surgeries or even for medical management. Encouraging patients to ask questions and participate in their care. Again, feedback mechanism. We encourage patients to ask questions. We participate in FAQ rounds. These all things would help us in maximizing patient engagement. So the second aspect is the impact of stronger connections with patients on health outcomes. What impact does it give if we establish a stronger connection? Benefits of stronger healthcare connections. Again, enhanced communication. Patient would feel heard and understood. If we communicate in a similar language, or if we show some empathy to the patient will, what we will gain in return, we will gain the confidence of the patient and the family also. It is very important to make family confident about the treatment. Before working with RG hospitals, we are a surgical center basically. We we are known for stone surgeries and advanced general surgeries, and even cosmetic surgeries like bariatric surgeries, which we do for obese patients. So before joining this organization, I was associated with Fortis Hospitals, Ludhiana. And before Fortis, I used to work with the standalone mental health center, Mind Plus. So there I felt this thing, because it is a mental health center. We used to treat patients with psychiatry or de-addiction disorders. So their family support and family guidance and even winning families' confidence over the treatment was very important, because the treatment prolongs from 2 months to even 1 year. We had patients of schizophrenia which lived in the hospital for around 1 year. So that's where the engagement and building stronger connections with the healthcare organization is required. So there plays the role of communication. Then we have better adherence to treatment plans. With active involvement, patients are more likely to follow care plans, like discussed in the previous slides. When the patients are better involved, when the family is better involved, when the attendants are better involved, your patient engagement will obviously go high. Long-term relationship building, stronger bonds between patients and healthcare providers obviously would lead to a better healthcare experience. And now, here I would give an example. Uh, I don't know about overseas, but in India we have this culture uh, to follow one doctor's advice to generations. Like if my mother is going to a doctor, my mother would obviously say, if I have any problem, to be you also go to this same doctor. Okay, we have this in our culture because we believe that long-term relationships about on this advice is would be okay. So next would be the trust impact pyramid. How would it will impact on the trust? So like we have the base as the trust. Okay, what we will gain when the patients are engaged, okay, or your clients are engaged, it will give you 2x healthcare, better healthcare outcomes. We have discussed 3x organization reputation. Your healthcare organization or your hospital will obviously gain reputation. 4x patient loyalty, and over and above to get the revenue growth because it is a business setup, business oriented field, obviously. So your revenue growth would also go high. Then the third aspect is, which is very important, which I would say that is the keynote of this whole session, the role of technology, communication, and the trust and engagement. I have discussed that this is era of technology. So role of digital health tools. We have seen numerous, I have put examples also in this slide. So we have patient portals these days. If you go to hospitals, right at the reception desk or the front office desk, they enter your details in your database. Then a registration slip comes out. Your patient has been registered. Say sometimes you get messages also. So what we are doing, we are using hospital information system. Okay, that is called HIS. So HIS has all the information related to that patient. And in some hospitals, even medication prescriptions, your all health records, your investigations, your blood investigations or radiological investigations, your reports, even the trends, and sometimes even the doctor's notes or the prescriptions and discharge summaries are even kept in that whole system, so that whenever the patient comes again, this will again ensure patient engagement. Whenever the patient comes again in the OPD, the doctor will right away go to the portal, enter the ID of the patient, and they can access the whole information. The patient will get happy, obviously, that the doctor remembers everything, each and everything. Patient might also not know that they have everything or we have everything in the portal sometimes. So patient portals are really a very good option, which we are following in the healthcare industry from the last 15 years already. And again, if you have ever booked any investigations from the app known as Healthians, it gives you a very good trend of your investigations. If you it is a medical lab related application, so it gives you a very good trend of your or lab investigation. Sometimes they give you a reminder also. Like I booked a test for my wife; she was having high TSH values. So once we have taken the treatment, after 3 months, I got a notification on that app that this is the time to get the test done again. So these patient portals help you actually in patient engagement. Then we have mobile health apps. We wear sport wearables. We use Apple Watch. We use Samsung Galaxy smartwatches, or we use Google watches. So they track your health data. They give you reminders, and in some countries they are linked to the central data of your health. Like in US, I have heard that the Apple Watch data goes to the central medical data because there the medical access or the all the healthcare access is all government oriented. They have apps or they have IDs. Even in India, we are going to start these things. I've heard. So again, telemedicine we have discussed. We have a very good portal in India which is running post COVID. It gained a good reputation in the market. Practo, if you have ever heard. If you search for doctors, you can easily have Practo listed above, like the doc with the doctor's name, and you can just go and book the consultation, and you can get the advice online. So it is a very good platform for telemedicines. Next is creating online presence for patient engagement. This is again a very uh, concerning, and I would say that it is, you can easily see in every hospital they create their page on social media. They create their presence on uh, even in on LinkedIn for business outcomes or maybe revenue upscaling. So a responsive website is very much essential for having easy access and patient engagement. Like it is saying, the modern website with easy navigation access to essential information. So online scheduling, like we have discussed about schedules, like we have discussed about the application or that website Precto. Sometimes hospitals are giving, few of the hospitals are giving option for booking the schedules through their main website also. You can book the appointment, you can go to the hospital's website, you can look to the doctor's schedule available, you can get your choice on what kind of slot do you want for the consultation, and you can book the appointment. And likewise, patient will get engaged, doctor can connect with you, you can have access to your old reports, everything is available online. Then again, patient portal. These websites are again linked with the hospital's patient portal. And next we have leveraging social media for enhancing engagement. So sharing valuable health tips and educational content. These days you have seen that hospitals and doctors, they create many videos on different disease conditions, and majorly dietitians, they share a very good content these days. So even I know few of them by name, which share very good information, sharing on health tips and educational content, like what kind of food we should have. Same doctors are doing. They're educating people. They are creating videos which are named as mythbusters, so that patients can be better engaged. Sometimes even I have seen doctors, they don't even charge for creating videos, because they want to give this thing to community. They want to engage people. They want to make people live a better life. So this is again indirectly they are pulling in the patients, so that they can have better patient engagement and better clientele also. And showcasing your patient success stories and testimonials. People sometimes, doctors sometimes, they present their success cases, success stories, different surgeries. Like we also do in on our website. We also display. Like recently, we have done the largest stone of kidney stone, which was operated successfully without or minimally invasive method was used. So that was the reason. These kind of victories which doctors celebrate, they share with the patient, so that patients can get comfortable, they can watch the videos, and they can correlate their condition with the patients, and they can come for the treatment. And again, likewise, if they have more patients engaged, they will have more clientele. Connecting with patients on a personal level through question and answer sessions. This is again, people are, even doctors are very much engaged these days to deliver podcast, where they sometimes they have scripted podcast where they can answer questions to the frequently asked questions of the patients, and sometimes the podcast are very unscripted and real, so that actual questions can be answered of the patients or the common man. Targeted advertising for patient engagement is the part of content marketing. We run paid campaigns on search engines. We run paid campaigns on social media. This is again, this will help. This helps the organization in building revenue also, having better clientele also, and patients are also engaged. Like we have from the RG Hospital side, we have a campaign running online on Facebook and Instagram, that if you're suffering from fibroids, get in touch. We have evening OPDs also available, or if you have kidney stones, get in touch. So a relatable, you have seen a relatable image would be there, like pain in the flank region, and patients correlate and they get engaged. Okay, I might feel pain in my flank region, so I might have a stone. So okay, I should book an appointment. So appointment button is also there. So this kind of content is also created for better patient engagement. Now, this is the most important part, that how can you build trust with the patients while patient engagement? Building trust through patient success stories. It is very important. We have discussed. If we share patient success stories in public, patients will be more engaged. They would build a trust naturally. So we can demonstrate the impact of our services, how it impacted the patient's life, especially patients suffering from chronic diseases. Like in my ex organization, we did a kidney transplant. It was a very difficult case. So we created a podcast also with the doctor and even videos also to showcase that what we did and how we did, and we got many leads out of that. We obviously it will give you a revenue boost also, but patients are also engaged, and that creates a trust in the society of the doctor also. Personal corrections, creating relatable and inspiring stories. So this is again testimonial about. And never forget to be transparent. So this is in continuation with the last and foremost point we were discussing, how to build trust. You have to be transparent. Never think about forging data. Never think about any kind of fake information to be presented in social media or anywhere related to healthcare, because this will obviously land us in trouble. And you should be clear about treatment options, cost, and expectations. Consistency, we have to ensure continuity of care and follow up. Empathy and support, we have to understand and compassion, especially during difficult diagnosis and treatments. So we were discussing consistency, ensuring continuity of care and follow up. Continuity of care, it is very crucial to understand that how continuity of care is linked with patient engagement. I can give an example out of my examples only. I've discussed about patient portals. When the patient portals have enough data of your old history and records, and doctor is able to view that data in your next visit, that will link to continuity of care. So, ensuring continuity of care and follow up is very necessary for patient engagement. Empathy and support, we have to understand patient situation. Sometimes patient wants time of the doctor, extra time of the doctor. Sometimes the patient needs extra counseling. So, this is again very important. Then, as I have discussed, involving family and caregivers. This is utmost important. Recently, we have conducted a study over here. We were just having a random survey of our patients. As we have nephrology department, we have patients of chronic kidney disease (CKD). So the caregivers attached with the attendants of the patients, attached with the patients, we were actually trying to find out what level of depression or anxiety is prevailing between the patient or the family member of that patient who is suffering from CKD. So we can easily find out through that survey that high level of caregivers, attendants are suffering from depression, not the patient, the caregivers. So it was really, we were all astonished to know that we were actually expecting that patient would be feeling depressed because patient life is very, the quality of life is very poor. That's the reason. So we were really amazed to know. So that's the reason why family members should be involved in patient engagement. Now, there are some challenges which we need to understand that if we engage patients or if we are in this process of engaging patients the way we have discussed. So, there are some challenges also. Like we have data security concerns. We need to ensure when we generate a data, that data is confidential. And patients' data, it is a medical legal aspect. We have to be very much, we have to doubly sure that the data security is up. In our hospital, we ensure our servers are firewalled properly. No access should be there. We cannot access our own hospital portals from our home internet. So these small things we need to take care. Patients should never get access to the data, or one patient cannot access other patients' data. So these things we need to understand. Technological limitations. Not all patients have access to necessary technology. Like we have discussed about patient tools, health tools. All the patients, sometimes they don't understand what is telemedicine, what is online consultation. So this is again a challenge for us. Resource allocation. If we are generating data in hospital inside the healthcare organization, then we have to deploy much staff. We need to have people in medical records. We need to have people at reception. We need to have IT cell to handle to troubleshoot such issues, because all this data gathers, which is related to patient engagement, and we cannot just leave this data unsecured. We have to ensure that these should be in safe hands always. So here I can share an example. 2 years back, if you have heard, Ames Delhi. So they have an outbreak actually where the data was hacked. So even as far as I know, it was really uh, amazing for all of us, and it was really shocking that such a high level of institute, which is running under central government, even they could not able to secure the data of the patient, and even the news was not spread. And maybe the government has snubbed these news about this data malfunction, but there was something, and it was really in all our healthcare organization people we used to talk about, and at that time even extra measures have been taken in hospitals to ensure that data is safe with us. So I guess this is the second last slide. Just check. Yes, so this was all about. I'm just putting up the last slide up. So this is all about patient engagement. So patient engagement is actually a vast topic. We can have more conversation on that also. But the thing is that obviously time is very limited with all of us. But I would like to know that what all we have discussed till now. Are there any questions among you, among the students or the faculty sitting over here? You can ask questions, or you can ask questions related to any healthcare operations if you want.
Good afternoon, sir.
Hello, good afternoon. Yes.
So my question is how to improve adherence of patients to physiotherapy treatment and protocol.
How to improve adherence of patients to physiotherapy treatment, right? Is that the question?
Yes, sir. Yes.
Okay. So before answering this question, I would like to ask you a question first. What you do uh, for this to manage this kind of issue? What you are doing currently? आप क्या करते हो अभी करने के लिए इसको?
Can you please repeat the question? He's asking
Sorry?
what you are doing.
Currently.
Currently pursuing bachelor's of physiotherapy.
No, no. I'm asking what you would do if you would in this problem. You want maximum patient engagement to your physiotherapy treatment, right? Is that the question? Okay, I'll answer. I'll answer that. Like what I understand. Sorry. Okay, I'll answer the question for you. What I believe, like we have discussed, you can once you have pursued your course and you have established yourself as a doctor. What you can do, you can once you have started your building your clientele, then you can generate success stories and you can share those stories with your patients in your local group also. I have many physiotherapy friends with me who actually share their success stories over WhatsApp group even, and this will slowly gradually will create engagement and among your fellow colleagues and even the community which you are serving, like your colonies or your society's WhatsApp group. They will have a trust, or at least they will have in some awareness that you are a physiotherapist and you are running a clinic, and you have some success stories. So why not give a try? This will gradually give you patient engagement. And again, like I have discussed, there are doctors, there are people who are sharing healthcare tips. You can share uh, your preventive, like tips on ergonomics, better sitting position, or whatever, like daily routine challenges what people face with their health, which a physiotherapist can meet. So you can share such kind of, you can make such kind of videos for patient engagement. Any other questions? Okay, so how was the session? It was informative. Okay, I would love to take more sessions with you. I would love to see you in person. We can have more sessions. Thank you. Thank you for being a patient audience. And I would really love to see you in person and to discuss more on healthcare operations. My background is from quality assurance. I was majorly working in quality assurance department. I headed quality assurance. Quality assurance is basically, in simple terms, accreditation of hospitals. So I have a background of healthcare quality officer, patient safety officer, and later I came into hospital operations and business. So again, thank you to the management of university who have given me this opportunity to share my insights on this topic. Thank you, Anshika. I would love to connect with you all again. Thank you so much.
Thank you, sir. So, as we conclude this insightful session, we extend our heartfelt gratitude to sir for sharing this invaluable knowledge and making a complex concept very easy. So, the session was highly knowledgeable and truly engaging. And thank you, sir, for your valuable effort. As token of appreciation, we present this memento to you. And thank you once again, sir. We look forward to more such inspiring sessions in the future. Thank you, sir.
Same here. Thank you so much. Should I sign off? Thank you. Okay. Yeah, lovely. Thank you so much.
Thank you, sir.
Okay, I'm signing off.